We know that relatives say that she is from the Fincastle area, so we are working to learn more about our local cases. Governor Ralph Northam is stepping to the podium now in Richmond. Let's go to his remarks.
To the press for being here, and thanks to all Virginians who are either listening or viewing this from home. I want to start again this morning by thanking our medical professionals. As a doctor, I know what it's like to be on the front lines in a hospital. I want to thank all of our doctors, nurses, other health workers, staff, and our lab technicians who are going into work every day. They are literally our front line of defense, and they need our support and our protection. It is up to all of us. It is up to all of us to keep them healthy. In a moment, I'll ask Dr. Lori Furlano, our Deputy Commissioner for Public Health, to update you on the latest data. Before she comes up, I want to talk about 4 things. First, today we're announcing that our testing criteria will give additional priority to medical professionals who have had contact with or cared for someone who has COVID-19 and have developed any symptoms. We're also easing some of the criteria for folks in nursing homes and long-term care facilities to get tested. We also are working to get more of the supplies, the masks and gowns that our frontline healthcare providers need. A shipment of PPEs, personal protective equipment, was distributed to providers yesterday. Last evening, I signed an executive order that will allow our hospitals and nursing homes more flexibility to add beds during this situation. That order lifts our Certificate of Public Need restrictions so that our health commissioner can give hospitals and nursing homes the authority to add the beds they need without going through red tape. They can act quickly to respond to the needs in this fast-changing situation. Also yesterday, the Federal Department of Education announced that it will accept waivers from states for federal testing requirements. The Virginia Department of Education is already preparing Virginia's waiver. My administration is also considering actions necessary to provide relief to students on state-mandated SOL tests, which go beyond those mandated by the federal government. We want to make sure our high school seniors who are on track to graduate will be able to do so. We understand that while everyone is focused on this epidemic, the business of government must be able to continue. Attorney General Mark Herring has issued an opinion that says public bodies in Virginia may conduct meetings electronically if the purpose of the meeting is to address the emergency. That includes meeting to make decisions that must be made immediately and where failure to do so could result in irrevocable public harm. The opinion also outlines important limitations, saying that the General Assembly did not intend to permit public bodies to handle all business through electronic communication means, even during a declared emergency. General Herring's opinion makes clear public bodies should ask themselves, is the action we're taking truly essential? If not, they should defer it until they meet in person again. We're not throwing out public accountability and transparency measures because there is an emergency. Bad policies can happen that way. The regular features of public meetings remain critical, including the need for public access, proper public notice, publicly available agendas, roll call votes, and recorded minutes. Now I'll ask Dr. Furlano to provide you an update from our health department. Dr. Furlano, welcome and thank you.
Hi, good morning. My name's Dr. Lori Furlano from the Virginia Department of Health. As the governor described, we've refined our testing criteria, which I'll describe in more detail in a moment. As of March 21st, we have 152 cases of COVID-19 in the Commonwealth. There are 25 in the central region, 42 in the eastern region, 77 in the northern region, and 6 in the northwestern region and 2 in the southwest region of Virginia. We are glad to say that as the situation has evolved, we've revised our testing criteria. We're prioritizing healthcare workers and those responders who have had contact or cared with COVID-19 patients. We want to make sure that they are protected so we can ensure the continuity of care. We are focusing on testing those who are involved in clusters of respiratory illness where flu has been ruled out, with a priority for healthcare facility outbreaks. The testing criteria for hospitalized individuals with more severe illness remain largely the same, and the testing criteria for persons who are residing in nursing homes have been slightly relaxed to remove one testing component that previously existed, and we hope that will relieve a barrier for testing for those individuals.
Thank you, Dr. Furlano.
Thanks.
Lastly, I want to remind Virginians to be wary of rumors. Uncertain times like this can give rise to a lot of bad information. For example, I've heard the rumor that Virginia is mobilizing our National Guard. To be clear, when I declared a state of emergency last week, that activated the Virginia National Guard. It did not mobilize them. That tells Guard members to stand ready to help when we need them, and I can assure you that they are ready. The National Guard regularly provides assistance in natural disasters, for example, helping to transport supplies. Some Guard members are doing that at our Emergency Operations Center, and I thank them. When you hear information, please check the source. And I want to remind Virginians to please get your health information from the Virginia Department of Health, the CDC, or other reliable medical sources. In closing, I want to thank those who are taking social distancing seriously and abiding by the 10-person restrictions in their gatherings. I want you to continue to take basic health precautions, washing your hands with soap and water, not putting your hands to your face, the social distancing, which I already mentioned, and covering your face if you sneeze or cough. But we said we're watching Virginians, and I'm proud of what most Virginians are doing, but let's be clear. There are a few people that are not yet getting the message. If our restaurants, our fitness centers, or theaters stay open with more than 10 people, with more than 10 patrons, you can be charged with a misdemeanor and lose your operating permit on the spot. This is real. I am taking this seriously, and I ask you to take it seriously as well. We will get through this, but it is imperative that everyone does their part to limit social interactions and slow the spread of this virus. Again, thank you all for listening this morning. I'll be glad to take questions.
Yeah, I just had a question. With the growing number of doctors calling on the state to increase the supply of
Yes.
PPEs, are there plans to do anything other than just ordering more equipment?
It's a great question. Dr. Carey is prepared to answer that question, sir.
Thank you, Governor. The question is about PPE availability in the Commonwealth and what we're doing about it. I think first and foremost, we're distributing what we get from the national stockpile. I think also whether it's a private practice doctor's or provider's office or our health systems, they are also using all of their supply chains to make sure we have as much PPE as our providers need. Critically important. Second, at the Virginia Emergency Support Team, the VEST Logistics, they are looking at following every lead. We're getting lots of leads from folks, whether it's General Assembly members or folks in industry or in healthcare that have some leads on where we might get additional supply. And we are following those down to make sure that those is that a real possibility? What's the lag time? And what resources it will take to get those online. We are also looking, we've had industrial suppliers, for example, of personal protective equipment around mining and quarry work that have the same N95, N99 masks. They may look a little different, but they're perfectly serviceable in the healthcare environment. So we've had those suppliers contacting us, and we've been working on that procurement. And we've even had some manufacturers in Virginia who may be able to make N95 and N99 masks very quickly. So we are not, that has not come online, and we are pursuing every opportunity. And I think it's also important to say that this is a national problem. This will not be solved without a national solution. Otherwise, you have each state grabbing for what they can, and we are in a responsible way. But we need a national solution. We've heard about the War Powers Act, but we need manufacturing collection manufacturing and in meeting those supply chains so that the frontline medical first responders, folks in prisons, et cetera, that are in contact with patients with COVID-19 or those that might have it, have the protection they need. So this is a national emergency within a national emergency.
Governor, are you considering a workforce limitation order like that of other states, specifically like New York?
You know, this is a very fluid, the question is, are we considering a workforce limitation? This is a fluid situation. It's dynamic. It literally, as you all see, changes hour to hour. I assess what is happening, not only in Virginia, but in this country, hour by hour, and make decisions accordingly. As we've already mentioned, I have input from a lot of different people, well-intended people, and I appreciate their input. But we have taken aggressive steps in Virginia to combat this, to keep it under control, to flatten that curve, if you will. And I'll continue to monitor it and make decisions as necessary to keep Virginians safe.
But what might it take to implement such a workforce limitation order?
Again, I'm not here to answer what ifs. I'm telling you where we are today and what we're doing to keep Virginians safe.
Laura. Hi, Governor. Can you talk about what hospitals might be already looking for additional beds if they are at that point yet?
Your question, Laura, is if they need increased capacity, what means are they taking to?
Well, you had mentioned that you signed this order last night.
Yes, absolutely.
Do that. Do you have specific hospitals that have said, okay, we need X number more beds, and we don't want to do it in this location or a tent?
Great. You know, it's all about preparation. And Dan, if you want to just
Sure.
elaborate on that, thank you.
Thank you, Governor. The question is about, one, the COPN waiver was, the governor mentioned in his remarks, and what have we heard from the health systems about what they're doing? And first of all, that is coordinated through the VEST, and there is the Virginia Hospital and Healthcare Association there with the VEST members looking at how to distribute PPE, for example, and also looking at what opportunities they have. There is the kind of three levels. There's the first level is what they can do on their current footprint. And talking to hospital senior leadership around the Commonwealth yesterday, they very much have their plans in place and how they will get from A to B and what will need to happen for staffing. Second is, are there adjacent areas on health systems and communities' footprint? And then there's really national-based things where we're already looking and planning with the National Guard, planning, not mobilizing, along with FEMA, getting those initial plans of what alternative sites for medical care would look like and what those requirements. So that planning is happening and very, very robust.
Yes, Kate. I've been getting some calls from doctors saying that in terms of testing supplies, in some areas they're running so low that hospitals aren't even performing flu tests. Is the state aware of anything like that, or is there any validity to that?
Kind of information. I can't validate that information.
The state doesn't have that type of information.
The question was whether areas around the Commonwealth are foregoing testing or are not doing influenza testing. I have heard that transport media are in short supply, and I'm looking over to Dr. so that the swabs are in short supply in particular. And I'm asking a question, Dr. Tony. The swab that can be used, there are swabs that can be used for either. Yes, so they're viral transport media. So that would be a rationale for not doing one versus the other, but I have not heard specifically that those are being traded off. Dr. Tony, any additional comments? No. Thank you, Governor.
Yeah, I was going to say, do you guys know or have a specific number how many tests are still available in Virginia? And if you guys do know, are you guys comfortable with that number?
Yes.
Thank you, Dr. John.
Good morning. I'm Dr. Denise Toney, the Director of the Department of General Services Division of Consolidated Laboratory Services. So your question was, did we have a number of tests that are available in Virginia? And what I can answer is with respect to the capacity at the state lab, we have the ability to perform testing for over 1,000 patients. We are continuing to receive additional supplies that increase our capacity, and we have also changed the number of specimens that we are testing per patient, which also has supported our ability to maintain more tests per patient. There are also hospitals and private laboratories within Virginia or supporting Virginia that have testing capacity that also increases our number and the availability of tests for the citizens of the Commonwealth if they meet the criteria.
Have any, Governor, you mentioned that there were some bars and restaurants that aren't compliant. Have anyone been charged with a misdemeanor or have their permit revoked yet?
No, they haven't.
Yeah, going back to my question from yesterday, as we're continuing to see cases go up as more testing is done, I'm wondering again, whether we could extend the emergency order to apply to more types of businesses to make it enforceable, to actually enforce the 10-person limit that you said, or if there are any thoughts of, restricting movement in areas where case numbers are highest, like Northern Virginia.
Again, this is a dynamic situation, and we monitor that literally minute to minute, hour to hour. What I would say in response, I think, of most importance is it's all of our responsibilities. It's really in the people's hands of Virginia, and we will do what we need to do to enforce. But I would encourage Virginians that if you don't abide by our guidelines, you're not only putting yourself at risk, but you're putting others at risk. And that's something that we should all take into consideration. And when I say others, our family members, our parents, our grandparents, and perhaps most importantly, our healthcare providers and our first responders. And as I articulated earlier in my comments, we all collectively need to do everything that we can to keep those individuals healthy because they are literally our first line of defense. So I encourage all Virginians to abide by our guidelines.
All right, we've got time for one more. Yes.
This question is a follow-up to the ease of testing requirements for first responders, for primary care physicians as well, and those in nursing homes. Where specifically throughout the state is this of need immediately? How soon will these factions get those tests that they now have access to?
Thanks. So the question is about the revised testing criteria, specifically healthcare workers and the nursing home criteria, and where geographically that is of most need.
Yes.
I'd say the first thing I'd say is that the testing criteria apply Commonwealth-wide. So where those outbreaks are occurring, where the nursing home situations occur, obviously that's where it would be directed to first. And that situation definitely evolves on a daily basis.
But based on the outbreaks that have been noted, we're talking about Richmond and in the Peninsula area as well, correct?
Wherever they may pop up. But yes, those are the ones we're aware of right now.
Thank you so much.
Just in closing, again, thank you all for being here. Again, please take into consideration to take care of yourselves out there across Virginia. We're all in this together. Check on your neighbors. Check on individuals, especially elderly, those that have medical conditions, to make sure that they're okay. I tell people all the time as I travel around the Commonwealth that it takes a village, and we're all part of that village, and I thank you all for continuing to work with us and helping all Virginians. So we will see you again tomorrow at 11. Thank you very much.